important, significant improvement in overall survival for a notoriously aggressive disease. And I agree completely with the authors that this represents a new standard of care for these patients, and I'm glad to see the important qualifications that we must do this in people with a good performance status. It would be tempting to give this regimen to anyone after a pancreas cancer surgery, but because FOLFIRINOX is a relatively challenging regimen, and as we see there are more toxicities from it compared to the single agent gemcitabine, we need to make sure that we recommend this regimen in the appropriate people. People are healthy enough to withstand the rigorousness of the regimen, and I agree that it does represent a new standard of care, and it's certainly one that I would choose for such good performance status patients. That being said, there are other regimens, both recently reported last year as well as forthcoming. We'll see if another combination also extends overall survival and compared to gemcitabine, but this certainly is very welcome news for a notoriously hard disease, and I applaud the study authors.
Yeah, just to add one fine point. Unfortunately, still today, only about 15% of patients who present with pancreatic cancer actually are resectable. And so these findings only apply to that group of patients who can undergo that surgery. So, it just again raises the issue about the importance of, early diagnosis for patients with pancreatic cancer, which remains challenging. But that said, I think as of today, to me, this is probably the biggest advance we've seen in pancreatic cancer since the introduction of gemcitabine, which is now about 25 years ago. So this is, I think, a huge step forward, at least for those patients who are able to undergo surgical resection. So congratulations.